Within MICRA we have a number of projects going on at the moment across the university around older workers. It's a really important topic for us.
In Britain at the moment, something like a third of the workforce, nearly a third of the workforce, I think 31% of the workforce are over 50. So this is an increasingly important segment of the workforce. We've got over 1 million people now working on beyond state pension age, but still a lot of people find that if they lose their jobs in their 50s or early 60s, it's extremely difficult to get back into work.
We know we're all going to be working to an older age. What I'm interested in is what does that mean in terms of health and well-being? Are there things we can do to protect people's health and well-being, to help people to be able to work to an older age without work being too damaging to them in terms of their health?
We've recently had changes in legislation to do with the increase of state pension age, the equalisation of men and women's state pension age, and also the removal of the default retirement age. So theoretically now people can work up until any age they would like.
The transport sector has got a big issue in terms of an older workforce, so the majority of people are of an older age and they're seeing very fewer younger people coming into the profession. So for that sector as a whole, there is a need to try and make sure that people can stay healthy and stay in the workplace.
The project we're working on is called Aspire. Aspire stands for Active Ageing Through Social Partnership and Industrial Relations in Europe. And we're really trying to engage with employers and with trade unions to see how far the process of interaction between employers and unions can assist them in putting into place measures in the workplace, around the workplace, that will support the whole concept of active ageing.
I have two main plans for future research. Firstly, policy influence. We hope to bring some of our findings into policy to change legislation in the future, and secondly, to do large population studies to identify which sectors tend to discriminate more against older workers.
We are now thinking a lot about these inequalities in health and financial well-being coming up to state pension age and going beyond state pension age, and that is becoming more important as state pension age rises. So really my future research plans are all about a focus on these inequalities and how we as a society start to reduce inequality in later life.
If we can help employers and unions to collaborate in a process of social dialogue, to put into place the kinds of measures that will make it easier for people to have active later lives, both including employment and engagement in society and many other things, then that is good for them, it's good for employers, it's good for the economy as well, and it's actually good for the older workers in particular.